Hello, my name is Jesly Cordero. I'm a pre-medicine student at the University of Puerto Rico at Mayagüez, and I will be talking about fecal microbiota transplant. Over the years, inflammatory bowel disease and many other gastrointestinal diseases and infections have increased, as well as other neuropsychiatric diseases, autoimmune diseases, and others that I will be discussing further on in the presentation. Not only in the United States, but in Puerto Rico as well. This transplant can be the next permanent cure for such diseases and infections. What is fecal microbiota transplantation? Fecal microbiota transplantation is also known as bacterial therapy and/or fecal transplant. According to Johns Hopkins Medicine, fecal microbiota transplant is the transfer of feces from a person into the gastrointestinal tract of another person. Fecal microbiota transplant is used for treating recurrent C. difficile colitis. According to Hopkins Medicine, as of 2013, it is used solely to treat C. difficile colitis. Some research is being made to see if fecal transplantation can be used to treat other things. Further into the presentation, I will be discussing some diseases that are being researched to see if FMT can cure it. Clostridium difficile colitis is considered a healthcare-associated infection. According to the Centers for Disease Control and Prevention, CDC, C. difficile colitis is a bacterium that causes inflammation of the colon. C. difficile colitis is shed in the feces. In this image, one can see the bacteria, which is the yellow lumps in the colon. C. difficile colitis is caused by resistance to antibiotics. Any surface that has become contaminated with feces serves as a place for this bacterium to grow. This bacterium is mainly transferred via the hands of healthcare personnel who have been in contact with contaminated surfaces. That is why it is a healthcare-associated infection. Some of the symptoms of having C. difficile colitis include, but are not limited to, watery diarrhea, fever, loss of appetite, nausea, abdominal pain, or abdominal tenderness. And some patients have one of these symptoms, or many of these symptoms, or none of the symptoms, but they can still have this infection. The first course of action is to discontinue any antibiotics being used. This may help stop the diarrhea. To treat this infection, physicians should administer antibiotics such as metronidazole, vancomycin, or fidaxomicin. According to the CDC, one of the problems for this treatment is that the infection can return. Fecal transplantation is the next step if the infection keeps reoccurring. According to the CDC, about 500,000 infections in the United States in 2011 were caused by C. difficile, and 29,000 died within 30 days of the initial diagnosis. According to a research article on the New England Journal of Medicine, where a study was made in North America between 2011 and 2012, the crude incidence of community-associated infection was 48.2 per 100,000 population. The fecal transplant is done via a colonoscopy or a nosoduodenal tube, which is less commonly used. The colonoscope is put through the entire colon. As it is being drawn, the donor stool is delivered into the colon. To be a donor, it is suggested for the person to be a relative or to live with the patient. They should undergo hepatitis A, B, and C serologies, as well as stool tests. Donors should not be immunocompromised, have had any tattooing or body piercing in past 6 months, have any history of drug use, have any history of high-risk sexual behavior, among others. As one can see, it is very difficult to become a donor. As one can see in this image, there are syringes with feces ready to be transferred. One of the benefits of this transplant is that it is the most effective for treating C. difficile colitis. Having this transplant comes at a low cost and a 90% success rate. One of the disadvantages of this transplant is that this procedure may not be widely available and its long-term safety has not been established. This treatment, like many other new methods for treatment, have raised ethical issues. Since fecal microbiota transplantation is an innovative therapeutic procedure, it raises many ethical questions. These problems include donor selection, safety concerns and ratio risk-benefit, and informed consent. As I said before, selecting a donor is a unique challenge. One has to make sure that the stool is properly tested in order to ensure that the patients will not get any other diseases from the donor feces. Fecal microbiota transplant is classified as safe. However, as it is a new method of treatment, more studies need to be made. As it is new, many clinical trials are being made. It is vital for patients to give informed consent. Patients should know that it is completely voluntary, and they should also know the risks and possible benefits for such trial. Now we'll be talking about a case study of a real woman who has undergone fecal microbiota transplant. Her name is Dorothy. She was a 69-year-old woman who went to the emergency department for ongoing diarrhea for over 2 months. She had been treated with antibiotics for a bout of pneumonia and bronchitis 5 months prior. She had been treated with metronidazole for the bowel issues, however, it wasn't resolved. Furthermore, they treated Dorothy with FMT and her diarrhea discontinued hours after her transplantation. Now we'll be talking about diseases that have been researched that could possibly be cured by a fecal microbiota transplant. Studies have shown that intestinal microbiota is linked to some metabolic conditions. These include obesity, diabetes, and metabolic syndrome. Investigations have shown that microbiota reactions act as a pivotal role in the pathogenesis of these endocrine diseases in animals. Studies have also shown that fecal microbiota transplant can contribute to neuropsychiatric disorders. In patients with Parkinson's disease, constipation has a high incidence rate. Cases in which patients are treated with antibiotic therapy for constipation have improved their neurologic symptoms. It is also said that multiple sclerosis is associated with the intestinal microbiota. Patients in clinical studies have had fecal microbiota transplant and have gone to complete normalization of neurological symptoms. Autism is sometimes accompanied by intestinal dysfunction. There is evidence that shows that after FMT, autistic symptoms in children were in remission. The intestinal flora has been observed for people with chronic fatigue syndrome. In a study where 60 chronic fatigue syndrome patients were treated with fecal microbiota transplant, 42 out of 60 patients, which is 70% of the patients used, responded to the treatment. Fecal microbiota transplant can also play a major role in treating and curing autoimmune diseases. After a patient was treated with fecal microbiota transplant for idiopathic thrombocytopenic purpura, where not many platelets are able to be produced, normal platelet levels were achieved. Intestinal microbiota plays a major role in rheumatoid arthritis. Studies have shown that elimination of intestinal gram-negative commensals, which are bacteria, suppresses the progression of arthritis. Some hypotheses suggest that the disruption of intestinal microbiota drives the emergence of allergy. Using fecal microbiota transplant seems promising in restoring immune homeostasis, which prevents allergies. Studies are being made to see if inflammatory bowel disease and the other diseases I had mentioned prior to this slide can be cured with FMT. According to Appleyard and other authors, incidence of inflammatory bowel disease within the Puerto Rican population is increasing and may be higher than previously reported. Not only is IBD the only disease incidence rate increasing, but other common diseases are as well. That is why I implore professors, students, health physicians to do more research on FMT. This may be the next cure for inflammatory bowel diseases and diseases like Parkinson's disease, arthritis, and other diseases. Lastly, there is a list of articles of FMT. There are plenty more, however, these were the ones that stood out to me.